Hello students, welcome to EPG Pathshala. I am Dr. Rajiv Komal Kumar from ANCNI Institute of Social Studies, Patna. Today we will discuss the module on issues of health among Indian tribes from the paper Travel Culture of India. So students, let us see what we are going to learn from this module. The first objective of this module is to understand the concept of health in the context of tribal population. The second objective of this module is to understand the anthropological concerns in terms of tribal health. The third objective of the module is to understand the impact of health in the tribal development and role of healthcare administration. And the last objective of this module is to understand the importance of integrated development approach in improving the health status of tribal communities. As we know that the tribals are integrated part of India and they are living in this country since time immemorial in the isolated and semi-isolated areas of forest and hilly tracts. They are comparatively backward and they are less educated and less developed as compared to the general population of the country. So the government has to make extra effort to develop them and integrate into the mainstream development of the country. The tribals are always suffering from one or another disease due to their uh, habitations, their surroundings, lack of modern medical facilities, their medical practices, their traditional beliefs, their beliefs in superstitions, etc. Tribal people found all over the world and form a major segment of the world population. They are called by different names such as primitive, tribal, indigenous, aboriginal, native, and so on and so forth. India is one of the few nations of tribal concentration and is also said to have the largest tribal population in the world. The states of Maharashtra and Odisha share the largest number of tribes in India. Prior to the caste system, people were divided into different tribes. At that time, each tribe was a homogeneous and self-contained unit without any hierarchical segmentation of society. Each tribe had its chief as leaders. Gradually, the chief assumed political and military power and was recognized as the ruler. Thus, there emerged the republics and monarchies among the tribes also. The tribes were associated with large kingdoms. Each tribe had its own system of administration. There was decentralization of authority among the tribes. The traditional tribal institutions were vested with legislative, judicial, and executive powers. The concept of health. Health is considered as one of the most important indicators of development along with education and earning capacity of the individual. Health is defined by the World Health Organization (WHO) as a state of complete physical, mental, and social well-being, and not merely the absence of disease or any infirmity. So, a perfect healthy person has the physical as well as mental health. In general parlance, health means proper functioning of the body. That is, if a person is able to carry out the routine work without any stress, he or she is considered physically fit. The concept of health and disease are not absolute. It means that the concept of health and disease vary from one society to another from one culture to another and from one geographical region to another. Therefore, health is reliant upon a host of socio-economic, cultural, environmental, biological, and other factors. According to Vasu, 1992, health is a function not only of medical care but of the overall integrated development of society, cultural, economic, education, social, and political. Each of these aspects has a deep influence on health, which in turn influences all these aspects. Hence, it is not possible to raise the health status and quality of life of people unless such efforts are integrated with the wider effort to bring about the overall transformation of a society. Good health and good society goes together. So, for the development of health, it is necessary to have overall integrated development approach. The study of tribal health is, though not an exclusive task of anthropologists alone, as any development work should be done in the frame of multidisciplinary approach. Nevertheless, anthropology plays greater role in this context. Of all the social sciences, anthropology has the distinction of having fieldwork tradition, which is not found in other social science disciplines. Due to this, the anthropologists are in a better position uh, to be more familiar with the tribal health and its associated factors than the other scholars. An anthropologist collect data mainly through participant observations uh, and other qualitative methods such as focus group discussions, observation, semi-participant observation, in-depth interview, genealogical studies, etc. So, the anthropologists are more dependent upon qualitative methods and they give ample time among the communities to understand their way of life, their culture. So, in this situation, the anthropologists are better placed to understand the mm, health behavior of the tribal. Thus, an anthropologist certainly have more experience of a tribal life and he is in a better position not only to understand tribal life but also suggest adequate measures for the development for the benefit of tribal and the development. Health status of Indian tribals. Health and its correlates. Health is a prerequisite for human development and is necessarily concerned with the well-being of a common man. The Human Development Index comprises of three components, that is health, education, and income generating capacity. Health is a function not only of medical care but also of the overall socio-economic integrated development. The culture of community determines the health behavior of the community in general and individual member in particular. The health behavior of the individual is closely linked to the way he or she perceives various health problems, what they actually mean to him, or on the other hand, his or her access to various relevant institutions. The holistic concept of health culture provides a valuable framework for analyzing the work of anthropologists in health fields. However, very few anthropological studies are available in this direction, especially among the tribal population. So, we have different studies on the tribals, their development, their health, but the specific and exclusive studies on the tribal health problem are very few. Maternal and child health. Childbearing imposes additional health needs and problems on the women. physically, psychologically, and socially. Maternal mortality has been reported to be high among the tribal groups as compared to the general population. The chief causes of maternal mortality were found to be unhygienic and primitive practices of child delivery, lack of proper health facilities, less number of institutional deliveries, etc. As far as child care is concerned, both rural and tribal illiterate mothers are observed to breastfeed their babies, but most of them adopt the harmful practices of discarding the colostrum, which is very important prelactal feed for the baby. The other reason is the delayed initiation of breastfeeding and delayed introduction of complementary feeds. Usually, we see that the tribal women are more reliant upon only breast milk. In that case, the children, the infant, after the age of 6 months or 1 year, do not get proper additional nutrition, and due to this reason, the infant and children become malnourished. Vaccination and immunization of infants and children have also been inadequate among the tribal groups as compared to the general population of the India. The vaccination and immunization are usually less because of their conception about the vaccines and modern system of medicine. However, government has been able to convince them for immunization also. In addition to this, there are other socio-cultural factors such as existence of magico-religious practices and beliefs in black magic and taboos among the tribals. It has been found that some of the demographic and health indicators which are very important, such as maternal mortality rate, infant mortality rate, immunization rate, institutional deliveries, consumption of IFA tablets by pregnant women, ANC checkups, etc., are poor as compared to the general population of India. However, some of the health indicators are better in the tribals as compared to the scheduled caste population of the country. The infant mortality rate of tribal population has much lower rate as compared to the scheduled caste but moderately higher than the other caste population. Sexually transmitted disease (STDs) are most prevalent disease in the tribal areas due to poor sexual practices, less precaution, and casual approach of tribals towards the sexual diseases. Some of the sexual diseases, such as VDRL, was found to be positive in most of the cases of polyandrous Johnsari's of Chakrata in Dehradun. The genetic disorders, especially sickle cell diseases and G6PD, have been found to occur in high frequency among various tribal groups and scheduled caste population. The sickle cell disease has been found in most of the districts of central, western, and southern India. The prevalence is especially high among the tribes and scheduled castes of Madhya Pradesh, Maharashtra, Tamil Nadu, Odisha, Assam, where the reported cases are more than 15%, especially in the hyperendemic malarial zones. Prevalence rate is up to 40% of sickle cell trait has been reported in some of the tribals such as Adiya, Irula, Banyan, and Gonds. This is very alarming as the sickle cell trait among these travel communities is more than 40%. One of the major social factor is the design of the households of the travels. About half of the population of Andhra Pradesh, Madhya Pradesh, Bihar, Odisha enter their dwelling units by bending or crawling only. In Gujarat, Rajasthan, and Maharashtra, about a quarter of the population has such dwelling units. Most of these houses lack adequate ventilation or natural lighting, and in that situation, the travels, particularly the children, fall sick regularly. And the travel households also lack any toilet facilities, and the children of the family used to defecate just outside their household or in the campus of the house, and the travels don't take it seriously. As we have learned from the modules that the travel economy is mainly reliant upon their immediate nature, that is physical environment, and the forest based travel economy in most parts of the world is women centered. Women made provisions for the basic necessities like food, fuel, medicine, and housing material. Because of extensive cutting of woods by vested interests, the distance between the village and the forest had increased considerably. This situation forced the tribal women to walk a longer distance in search of the minor forest produce and firewood. In this rapid changing situation, the tribal women have been confronted with an extraordinary workload. Given this additional workload, even women in advanced stages of pregnancy are required to work in the agricultural fields or walk greater distance to collect the fuel and minor forest produce for the family, because the women are responsible for providing the food to the family in the tribal communities, tribal societies. To add to the malnutrition and additional workload, there was destruction of traditional herbs through deforestation and lack of travel access to the modern medical facilities. This, along with increasing ecological imbalance, resulted in diseases such as TB, stomach disorders, and malaria. You can think of the pain of the pregnant woman in the advanced stage of pregnancy. The tribal women cannot take rest even in the advanced stage of the pregnancy due to this kind of situation. Basic nutrition, sanitation, and health services. Tribals are the lifeline of India, but poverty, poor health, and low level of development has plagued the lives of tribals folk. The unequal distribution of assets, such as land, along with failure in crops due to erratic rainfall and floods, are causes of poverty and poor health. Most of the tribal population is deprived of basic human necessity of nutrition, sanitation, and modern health services. Even the tribal areas do not have the lowest kind of public health facilities, that is health subcenter. These health subcenters and primary health centers are found often closed in the tribal areas, and the tribals also do not go to these centers. The widespread poverty, illiteracy, malnutrition, absence of safe drinking water, and poor sanitary conditions, poor maternal and child health services, and ineffective coverage of national health and nutritional services have been traced out in several studies as possible contributing factor to dismal health conditions prevailing among the tribal population in India. It also contributes to the development of family, and society. Good health is a fundamental goal of development, and it has been realized that targeting health as part of development is an effective way of improving the welfare of people, including the tribal women. So, the public health services should ensure that all the tribal population should be covered in their area. These public health facilities are usually seen with inadequate facilities, inadequate infrastructure, and human resources. Medical officers and paramedical staffs are very less in numbers and running purely on the basis of contractual manpower, which is also not sufficient. So, to ensure the modern health services to the tribal population, the government has to think of upgrading the public health facilities in the tribal areas. It has also been found in different studies that the health seeking behavior of the tribal population is altogether different from other population. The tribals usually take the health problems not seriously, and in most of the cases they first try their home remedy or goes to the available quacks or any shamans in their locality. So they have their own system of medicine, and it is found that only in case of perennial illness or any serious illness they approach for the modern health system. This is also due to the distance of modern public health system from the residents of the tribals. And another important constraint in availing the public health facilities is the hesitant and reluctant attitude of the tribals in contacting with the public health facilities and interacting with the doctors and the staffs. They feel hesitant to go to the public health facilities to avail any services available in the health sub-center or primary health center. It has been found that only in most emergent cases they approach for the public health system, which is equipped with the modern medical facilities. So students, let us now summarize what we have learnt in this module. The health problems need special attention in the context of tribal communities of India. Available research studies point out that the tribal population has distinctive health problems which are mainly governed by their habitat, difficult terrains, socio-cultural practices, ecologically variable niches, and poor economic conditions. The health, nutrition, and medico-genetic problems of diverse tribal groups have been found to be unique and present a formidable challenge for which appropriate solutions have to be found out by the planning and evolving a relevant research studies. Insanitary conditions, ignorance, lack of personal hygiene, health and education, and are the main factors responsible for their ill health. Some primitive tribal communities like the Ongage, Charwaj, and Chompens of Andaman Nicobar Islands are facing the situation of extinction due to their poor health and isolation from the mainstream development. Some of the problems, as indicated by investigations, include endemic diseases like malaria, uh, which is very frequent as the habitat of the tribals are mainly in forest regions, which and introduction from the outside and otherwise like tuberculosis, influenza, dysentery, high infant mortality, and malnutrition. Uh, Venereal diseases also found among the tribals. Induced abortion, inbreeding, addiction to opium. The custom of eating tubers of Dayasra may cause or may lead to sterility as they contain substances used in oral contraception. So, the tribe may, the person concerned may face the situation of sterility and they cannot produce further. To meet the challenges of tribal health, the government has to rely upon the integrated development approach as health is a function not only of medical care but of the overall integrated development of society, economy, and education. Good health and good society go together. You cannot think of developing health of the community in isolation without developing the education, the economy of the people. So, integrated approach to the development is the best option for developing the health. Thank you.